Hey everybody, it's Laura from Train to Respond. I'm stopping by to just do a minute on something that's very important for us as EMS providers, fire, police officers, or even citizens, civilians, who are helping somebody who's been traumatically injured. There's something called the deadly triad in trauma patients. And the deadly triad is hypothermia, coagulopathy, and acidosis. Today we're just going to talk about hypothermia for a little bit. So hypothermia is defined as anything less than 35 degrees Celsius. But you know what? It can happen anytime. It doesn't matter what season it's in. It can be spring, summer, fall, winter. If your patient is injured and bleeding, it's vital that you keep them warm because hypothermia can set in and it has dire consequences. So as the body's temperatures drop, so does its ability to stop bleeding. And some causes of hypothermia can be massive bleeding, which we're seeing in a lot of these active shooter situations. In fact, you have 3 to 5 minutes to live if you are shot and injured in an artery. And that's why it's so vital to just simple basic bleeding control and tourniquets. Massive bleeding, head injury, and alcohol or ETOH intoxication can also cause hypothermia. They did a study of 71 trauma patients, and they found if they had a temperature less than 32 degrees, it was 100% mortality. 100% of them died. So this is not fooling around. You know what? They didn't really cover this super a lot when I was going to school. I went to school in 1985. But even through the years as I was learning things and doing continuing education, I may have heard of this a little bit, but it was not really something that they focused on a lot. And going through this training, I'm learning that this is very important for us to keep our patients warm or keep somebody who's injured warm. Vital to do that. It's imperative to keep our patients warm and to prevent hypothermia. So that's it, just a quick minute on the deadly triad. The next video is going to be on coagulopathy, and then one after that, acidosis, and then we'll finally wrap it up in what can we do? How do we want to treat these folks that are traumatically injured? I'll see you there.